My name is Ellen Hopper. I'm an obstetrician gynecologist here in Brookings. I work at the Avera Brookings Medical Clinic, and I've delivered hundreds of babies here at the Brookings Health System and hundreds of babies in my training elsewhere. The signs of labor are generally uterine contractions every 5 to 10 minutes, and they're usually painful contractions that take your breath away or that you can't walk or talk through. Another sign of labor would be if your water broke, so if you feel a gush of fluid vaginally, that would be a sign of labor, or bloody show, where you have a little bit of dark brown or bright red blood vaginally. Any bleeding like a period is abnormal, but sometimes right before labor you'll have a brownish discharge or a little bit of bright red blood that can be an early sign of labor. There are different stages of labor. There's early labor and active labor. Early labor is generally when you're having irregular contractions, maybe a little bit of bloody show, but the contractions aren't occurring every 5 minutes, and they're usually not strong enough to take your breath away or make you, kind of stop for a minute. Active labor is considered when your cervix starts to change with regular uterine contractions, generally at least every 5 minutes, if not a little bit closer together. And generally at the hospital we keep patients if they're in active labor, not necessarily if they're in that early or latent phase labor, because the latent phase of labor can last for days. And so we can't admit a patient until they're really in active labor. A patient would know if they're in active labor if they're having regular uterine contractions at least every 5 minutes, if they're intense contractions that take their breath away or they can't walk or talk through, or if their water breaks. And again, if there's any vaginal bleeding like a period, then we'd want you to come in and be evaluated. During active labor, your cervix has to dilate to 10 centimeters, and then generally the baby descends in the pelvis. Sometimes that can happen at the same time, but once the baby descends in the pelvis to a station, we call it, where the mother can start pushing, then we will have her start pushing, and that's considered the first stage of labor in medical terminology is dilation of the cervix. The second stage is pushing, and the third stage is actually when the placenta is delivered or the afterbirth is delivered, which happens within about 30 minutes from the time the baby is delivered. So the time it takes for someone to push and actually deliver the baby is highly variable as well. With first-time moms, generally without an epidural, we give them about 2 hours to push the baby out. If they have an epidural, we give them a longer time slot, and that's about 3 hours to push the baby out. For a mother who's had children before, we don't give them quite as long. We usually give them about 2 hours without an epidural to push the baby out, and about an hour with the epidural. Now those are just guidelines, so it's not a hard and fast stop. For some women, if the baby's turned a little funny, it does take longer, and we just wait as long as baby's doing well and mom's doing well. We'll give them as much time as they need. But those are general kind of recommendations from the American College of Obstetricians and Gynecologists. So immediately after delivery here at Brookings Health System, we place the baby skin to skin on mom's chest, unless the patient prefers that we not. That's generally our principle and our technique. We often let the father of the baby or a family member or the patient herself cut the baby's umbilical cord if they desire. And then we let mom have her time with the baby skin to skin. When the mother is ready for us to take the baby, there are certain interventions that our nursery nurses do, like weighing the baby, measuring the baby, and those sorts of things. But we do those whenever the mother is ready. It's not something that has to be done immediately after delivery. We like that skin-to-skin time to give the mom and her baby time to bond. We have certified obstetrician gynecologists, just like the bigger facilities, who have had the same training. And many people worry that we don't have the neonatal intensive care unit here in Brookings. We do deliver babies 35 weeks and up, and we do deal with high-risk pregnancies, but certainly if we feel that your baby needs more intensive care, we will either transport you to Sioux Falls if that's needed, or transport you and the baby if the baby is indeed born here in Brookings. I know that Brookings Health System provides great care because I had my baby here.